When you had a toothache in the 1800s, you didn't have to really go that far. Most barbers would take a gander and even pull a tooth for a fee.
Wait! You can't go, Dr. Barber! What if someone needs surgery or even worse? An emergency haircut!
Back then, being a barber was a catch-all profession. And when it comes to dental insurance, we still live with the relics of barbers' professional versatility today. Mariotto, author of the book Teeth, told The Atlantic, "In the barber surgeon days, dentist skills were among one of the many personal services that barber surgeons provided, like leeching and cupping and tooth extractions. They approached it as a mechanical challenge to repair and extract teeth. A dentist was the first to use anesthesia in the U.S. 1846 to remove a tumor during a public surgery. Extended surgeries were soon absorbed into a regular medical practice. At the time, dentists struggled to gain public trust, like medical doctors, who carried that air of intellectuals. Dentists, for all their usefulness, were, well, barbers, usually self-taught and not terribly consistent across the board. In 1850, the first school for dentistry was founded in Baltimore. Through a charter from the state of Maryland, dentists could not secure funding from the University of Maryland in Baltimore to join the medical school. Today, a professional and insurance schism still persists when it comes to medicine and dentistry. Medical insurance in America sprang from a need to make factories more productive. The Blue Cross Association in Texas promised blue-collar workers a total of 21 paid hospital days a year if they were injured. By the 1950s, insurance rates grew from 10% nationally to 60%. All the while, dentists were restricted to private practices. Patients had to pay out of pocket for dental procedures. In the 1940s, clothing stores were offering dental procedures at a discount rate to customers. That changed in 1954 when the International Longshoremen's and Warehousemen's Union established the first dental insurance. But it was an ongoing fight for unions to keep dental plans covered at work. The new plans were clearly needed. According to the CDC, in 1960, the average American over 65 only had 7 of their original teeth. But when Medicare was created in 1965, it also codified that divide, covering medical issues and leaving out dental. Again, most insurance companies followed suit. Now, 77% of Americans have dental insurance, but 90% get the coverage from their job, compared to 91% of Americans with medical insurance. 49% get medical insurance from their employer. The Affordable Care Act provided some change. It mandated that a child's health insurance includes dental. But as we live longer, we're finding out dental health is critical to overall wellness, especially as a Surgeon General report has found substantial links between oral health and everything from heart attacks to stroke to premature births.